Rwanda this week began vaccinating people in high-risk areas against Mpox. It becomes the first country in Africa to do so. Rwanda's campaign focuses on 7 districts that borders the DRC, which has been the epicenter of the outbreak and accounts for more than 90% of the continent's cases. SABC News correspondent Chris Omara joins us for more from Rwanda on the Mpox vaccination campaign. Chris, thank you so much for your time. Really do appreciate it. Can you give us a sense of the districts that Rwanda had chosen to focus on and how extensive the Mpox outbreak has been in those areas?
Well, so Rwanda is one of the countries that has recorded cases of Mpox, which were initially reported in the Democratic Republic of Congo. They haven't got so many cases, but they have already started, like you mentioned, carrying out this vaccination exercise, and they're working very closely with the Africa Centers for Disease Control to ensure that they get more vaccines to spread this exercise wider to the country. And the DRC has also received about 260,000 doses of vaccines. They're expected to start rolling out the vaccination exercise in the first week of October. So many of these African countries like Burundi, Rwanda, Uganda, and the DRC are working very closely with the World Health Organization, the Africa Centers for Disease Control and Prevention, and a number of other aid agencies like UNICEF, which are all supporting them to ensure that this disease is brought to an end soon, because it has been spreading very rapidly on the continent.
Do you have a sense of how many doses of vaccines Rwanda has available and whether or not they'll be sharing that with the bordering towns in the DRC where there is predominantly cross-border travel?
So all the vaccines that were sent to Rwanda are meant for adults. They haven't, according to the Africa CDC, most of these vaccines that are being donated to African countries are meant for adults. There's only one type of vaccine that is from Japan, which is supposed to be administered to children. That hasn't arrived yet. So right now they're targeting adults in that area of Rwanda, which is close to the Democratic Republic of Congo, where this strain known as Clade 1b spread to these countries, Burundi, Rwanda, Kenya, and Uganda. So they have identified some people, particular people who are vulnerable to contracting this disease, and they're the ones who are going to be vaccinated first, and then they will carry out another vaccination exercise later on, targeting more people to ensure that they cut the chain of transmission.
Yeah, Rwanda has said that they've vaccinated around 500 people thus far in the vaccination drive. And of course, we've seen across the continent just about 30,000 cases of Mpox having been reported. Do we have a sense of how many people Rwanda intends on vaccinating as it continues its drives and receives more doses of the vaccine?
Well, according to the health officials in Rwanda, they are targeting as many people as possible. They haven't clearly stated the number, but they are working very closely in those areas that have recorded the highest number of cases, the hotspots. And so they are starting with those areas, and then later on, when they get more vaccines from the Africa Centers for Disease Control, they intend to reach out to a wider area to carry out what is known as herd immunity, to ensure that they have a lot of people who are vaccinated so that the disease does not spread to other people in the area. So we're not yet clear about the exact number, but they're really targeting the hotspots, the areas that have recorded the highest number of cases so far.
Yeah. Chris Omara, thank you so much for that. Really do appreciate it. Chris Omara coming to us live from Rwanda.